over to Dibal, who will walk us through the program because it's virtual. The only unfortunate thing ni kwamba labda we will not delve so much into the topic. We are restricted in terms of times because it's only a 90-minute session. Over to you, Dibal.
Right. Thank you, Rose. So I want to extend a hearty welcome to all of you, our panelists today, Cabinet Secretary, Ministry of Trade, Industrialization and Enterprise Development, Honorable Betty Minor. Thank you for joining us. Also, the CAS, Ministry of Health, Dr. Rashid Aman, who is stepping in for Honorable Mutai Kagwe. Thank you for joining us today. We want to also acknowledge the Principal Secretary, State Department for Cooperatives. This is Ali Nur Ismail. Thank you for joining us. Principal Secretary, State Department for Public Service, Mary Kimonya. Thank you for joining us. Also, I want to acknowledge the presence of the CEO of the Kenya Film Classification Board, Dr. Ezekiel Mutua. Thank you for joining us. National Bank CEO, Paul Russo, we saw you. We are in the farm there. So we expect also to be hearing the bellowing there of cows. Thank you for joining us nonetheless. We want to appreciate also industrialist, scholar, and philanthropist, Dr. Manu Chandaria. Thank you for joining us as well. The CEO of Capital Markets Authority, FCPA, this is Wycliffe Shamia. Thank you for joining us. And we want also, and I know he's trying to join us, this is Ambassador Oyugi from the Ministry of Foreign Affairs. Also, we want to just thank him in advance for joining us, if that, of course, is going to happen. Sam Wale as well from KEPSA, KEPSA trustee and advisor, US representative. Thank you for joining us also as well. So I'm really stoked about this meeting, knowing that, of course, we are living in torrid times with the pandemic that is upon us. It has really changed the way we do things. Ideally, this meeting will have been held, you know, in a hotel somewhere in this country, that like we've always done before. But things have changed, and of course we have to adapt and move on, and of course see what also we can do with this digital transformation that now the circumstance that we are living in has brought us to. There's a lot that we're going to cover today, and also I just want us to be reminded that yes, you know, sometimes when you're using this technology, you might sometimes forget to, you know, mute and unmute your mic. So just as a basic house rules that we are going to be having this afternoon, and the terms of engagement is, yes, if you are, of course, speaking, yes, remember to unmute your mic. If you're not speaking, also just, you can mute your mic so that at least if you're speaking, actually, you can mute your mic, unmute your mic. And if you're supposed to be now, keeping quiet and listening in, you can unmute your mic. So Rose, maybe I just throw it back to you to just give us a bit of rules of engagement as we're moving forward briefly. Can you just remember to unmute your mic, please? Unmute your mic. Good.
Yes. Thank you, Dibal. Because our time is limited, I think the house rules will just be, if all of you can adhere, respectfully adhere to that. And the program, as we start, we are going to have the chief guest, CS Betty Minor, start off the program, and she will call upon the representative of CS Health, Mutai Kagwe. Over to you, Waziri, Betty Minor.
Thank you very much. Thank you very much, Rosemary. Thank you very much, the entire team that has put this together, Mheshimiwa Shem, and all of you. I think you've been going strong now for several years, so I want to actually congratulate you in keeping the diaspora going and keeping this focus. Dibal says maybe in another time we would have met physically, but I actually reckon that one of the things we've learned with these online engagements is that you get more participation online that sometimes you actually get physically. We had a webinar for our Old Girls Association about 3 weeks ago, Usually when we call the meetings, we get no more than 20 sometimes, but on the webinar, we had about 300 people signed up. So there's also another convenience that comes from this online meeting. So I encourage you to continue utilizing them, and people can still chit chat as you go along. Now, I'm not quite sure what I'm supposed to do, Rosemary, but I suppose the best thing is to invite CAS Rashid Aman to make the remarks that is being requested to make.
Thank you very much, CS, and good afternoon, everyone. I'm sitting in for the CS, who sends his apology. I think he has been assigned a duty at the last minute. It's a pleasure to be among this group, let me say, distinguished participants. The subject today, of course, is about economic recovery from COVID-19, post-COVID-19 economic recovery. And therefore, health sits right in the center of everything. We are here because of a health problem and a public health problem. Of course, the response to this public health problem or pandemic has cut across so many different sectors and has affected the entire globe. Let me begin by just reminding us as a country where we are today in terms of our COVID-19 statistics. As of today, we have 28,104 confirmed COVID cases in the country. The active number of cases is 13,394, meaning we have registered at least 14,610 recoveries during the course of this pandemic. The key statistics here is really the death rate, and we have registered about 456 deaths as of now. The comforting thing about the trajectory that our COVID-19 pandemic is taking, is that we have seen a fairly low death rate or case fatality rate. The 456 out of 28,104 translates to a case fatality rate of about 1.6%, which is fairly low. It's much, much lower than what was observed in many other places. And I think generally this is what we are seeing in parts of Africa. We are also seeing a high number of cases that are actually asymptomatic. In our case, 80% or more of positive cases tend to be asymptomatic. But I'm looking at this in relation to I have some numbers here on the Kenyan diaspora out there. And the figures I have here say you have about 281 cases amongst the diaspora. What is interesting here is you have 34 deaths from these 281 cases. This translates to a case fatality rate of 12.1%. And so I'm wondering why the difference. Is it the geography, the environment, or what? But let's not get into that. I just wanted to note that. The health sector, of course, plays a pivotal role in ensuring that we keep Kenyans healthy so that they are able to engage actively in socio-economic development in the country. The COVID-19 pandemic has ravaged the globe in almost every country, severely affecting social and economic activities. As a ministry, our core mandate is health. And on the fronts of health, in terms of the response to the pandemic, we are engaging in many areas, including development of policies, guidelines, carrying out surveillance, testing, clinical management, and containment management of the spread of the virus. And in this regard, we have developed and realigned quite a number of policies and programs and repurposed resources so that we can focus on the containment of the virus and management of the pandemic while ensuring continuity of accessibility to essential health services. We have often said that when we give our daily briefs, there tends to be a focus on COVID-19, but we're still a Ministry of Health, and we have a large mandate in ensuring that we are able to deliver health services to Kenyans, COVID or no COVID. We have developed almost over 70 policies, guidelines, protocols, and regulations relating to COVID-19, and these documents are available on the Ministry of Health's website. In terms of resource mobilization, the approach has been a one government approach to mobilize resources, to identify and reallocate funds so that they could be directed at the response, including identifying resources that will cushion or buffer the economic adverse effects, social and economic adverse effects of the pandemic. But as a ministry, our main effort has really been in containment of the pandemic and in strengthening our health systems so that we can cope with the pandemic as it runs through its course. In this sense, we work as one together with our counties, 47 counties, and support each other in the fight against the pandemic. Of note are several resource streams that have been made available to the counties, including provision of conditional grants to support them to build up their capacities and response to the pandemic. Additionally, we have worked with the Ministry of Foreign Affairs to approach different governments and well-wishers across the globe in providing for donations in terms of supplies, largely in the area of provision of personal protection equipment and laboratory testing reagents and products. We have also, the pandemic, I must say, has also spurred activity, local activity within the country. Many of our enterprises have repurposed themselves to be able to respond to the demands of commodities that are required in fighting the pandemic, largely medical commodities, the PPEs, mostly masks, gowns, and commodities of that nature. And we're very happy to note that the local industry has taken that up and are actually now meeting the demand of these products, which initially were scarce because of the worldwide demand. In light of nature of the disease and restrictions adopted on physical distancing to mitigate spread of the virus, we have literally been forced to rely on making use of ICT solutions in order to be able to go about our business, to communicate and to execute our businesses. And I think this is an experience globally. And it has, I think, opened our eyes in terms of how we can be able to work, sometimes perhaps even in a more effective and efficient way through using ICT solutions. We have applied several of these solutions in our response, particularly in the form of information management systems that we are currently using in our healthcare facilities, laboratories, communities, and homes for commodity management, patient management in both facility and home settings, and contact tracing of contacts of positive cases. In the convention, the Diaspora Convention of December 2019, I think the Alliance was informed that the healthcare market in Kenya at that time was projected to grow at US $65 million. And Kenya still remains open to private sector investment in healthcare. If the COVID-19 pandemic has taught us one thing, it has taught us that we need to be able to look ahead. We need to prepare ourselves for the future, because this is not the only pandemic that we are likely to see, that there may be other pandemics that will come up in the future. And we should not be caught unprepared and unaware. I think we feel we have the capacity and the wherewithal to be able to produce products that we could be able to use in our fight against any pandemic that might come in the future. Who would have thought that biotechnology and molecular biology products and techniques would be in the forefront of this COVID-19 pandemic? And I think we need to be looking in those directions. I feel that the opportunities for moving forward in the area of diagnostics are enormous globally, and particularly within Kenya. I think we have a good chance at this point in time to be able to move forward and develop our economy so that we can spur investments in biotechnology that can respond to our health needs. Some potential areas of collaboration with the private sector, and especially the Diaspora Alliance, and this is not exhaustive, but could include, number one, leveraging on the use of technology, largely ICT technology, to increase access to health and key services. Key investments could include provision of telemedicine and medical education through e-learning. These are policies and ideas that have been in place for a while, but I think COVID-19 has taught us that we really need to move in these areas. And the opportunity is there to move in those areas. Setting up of telemedicine centers within our national hospitals, our academic institutions, I think is key. And leveraging upon the high internet provision within the country and the extensive mobile phone network, I think provides us with the right environment to be able to advance some of these investments. Secondly, the area of diagnostics, medical diagnostics. As I said earlier, essential diagnostic services are key in health. And more, these essential diagnostic services are tending to the higher end of technology, whether it is biotechnology, ICT, or imaging technology. It's on the higher end. And I think there is, again, opportunity to move in those areas. These services are required and are going to be required for cancer, heart disease, interventional radiology, radio-oncology, which are all very are necessary and need to be provided for within the country. We have seen non-communicable diseases moving out in the forefront. Almost now, we used to be a country that looked at infectious diseases as our main problem. I think now we have a double challenge of a growing non-communicable disease challenge as well, alongside the infectious disease challenge that we have been battling for all these years. The marked increase in non-communicable diseases in Kenya, especially now in COVID-19, necessitates further investments to be able to deal with these challenges. The mortality outcomes associated with hypertension, diabetes, and cancer are a constant reminder of this pressing requirement. And as we speak, the 21st century's most valuable commodity is going to be data, a resource that is growing at an exponential rate. Opportunities abound in big data management, especially in disease surveillance, through prediction and response in outbreaks and epidemics. There is a key tenet in evidence-based medicine and data-driven decision-making. There is great opportunity in this area. Ministry of Health has for years been collecting data, health data, but we really need to be able to make use of this data. We need to mine this data. We need to use this data to inform us properly, to inform our policy making and the strategies that we adopt. And I think there's great opportunity there. As I speak about that, I could not leave out the opportunity that we need to exploit in advancing our country by investing in research and development, particularly in the area of biomedical and health research. This is an area, as a country where we are, I think we should be far ahead in that area, because we do have the talent, we do have the human resource, but we haven't invested much in this area. That's an area of opportunity as well. Earlier on, I had mentioned spurring domestic industrialization through domestic production of healthcare products. The time has come for serious focus on domestic production, not only on the PPEs and which we have seen come up lately, but really in the basic essential commodities such as essential medicines, pharmaceutical products, maybe even equipment. Part of the Big Four transformative agenda, the government has put in place initiatives to facilitate local production to broaden their external markets. And I think CS Betty Minor, you will agree with me. Together, I think we've been working in this area in terms of trying to promote local production of vaccines and other products. Further strengthening of the supply chain and logistics, management systems in health are also required and present opportunities in responsive and timely distribution of medicines and commodities. Opportunities in health financing exist through the promotion of prepayment and the provision of complementary health insurance services. As you may be aware, our universal health coverage agenda is moving on and is hinged upon providing insurance coverage through the National Health Insurance Fund, which is undergoing reform to be able to realize UHC. And therein, within UHC, lie opportunities for the diaspora as well in terms of investment.
Thank you.
Bwana Kas, sorry to interrupt. Kidogo, we are running late. Unajua tuko na panelists wengi. Some of the buzz buttons that you're pressing on are really very relevant. And we have many questions coming in. Unfortunately, if respectfully, I would need to pass it on to somebody else, but also take this opportunity, Dr. Rashid, to thank you very, very much from the bottom of my heart. This has really, there are many things that have been said about Ministry of Health, both good and bad. But, that shows that we're engaged. One of the things that you did mention, and I should have done it in the beginning as part of housekeeping, ni labda kupeana introduction. We are gathered today under the leadership of the global chair of the Kenyan Diaspora Alliance, Dr. Shemo Chodo. But other than that, he's being referred to as Mheshimiwa. Yes, he was once an MP, but also referred to as the father of ICT. And as he was pushing for internet connection those days, I think he must have been dismissed. Where are we today? This is the sole item that we are using in communicating. Dr. Chodo, karibu. Na pole Bwana Kas kwa kukata.
Thank you. Almost, I finished actually.
Yes.
Asante sana, Madam Moderator, Honorable Chief Guest, Honorable CS. I take it that Chief Guest allowed me to come in violating a little bit of the protocol. But that notwithstanding, I just wanted to say how grateful we are as Kenyan Diaspora Alliance. Today is not our day. Today is our guest's day. Other than that, just to confirm, Dr. Rashid, thanks a lot. Senator Kagwe did call personally to apologize because of the other state responsibilities. We've worked with the ministries so closely, just like we've worked with our chief guest and the various ministries she's been very closely. The only thing to add here is Honorable CS, Public Service and Gender, Madam Pierce is sitting in that capacity as well. We are overwhelmed with the government support and embracement of the diaspora. Just to say that in terms of digital health, in terms of possible vaccine, some of our members in Boston are saying, look, why do we have to wait for the others to give us these facilities while we can manufacture our own in Kenya? So Waziri, I just wanted to say, we think as Diaspora COVID Task Force, we probably have an answer, but we'll take that offline with the ministry. We're glad the ministry has been pushing natural foods, and we can't thank you enough for that. That's the way we believe we need to go, indigenous knowledge. Other than that, the Kenya Diaspora Alliance is excited, and much of our information can be got online through our web portals. Meanwhile, Dr. Shiro, co-chair of the task force, who I think just slept 2 hours, may just say one word on behalf of the task force. She runs a clinic in LA, California. Dr. Shiro, otherwise, thanks a lot, moderator. Today is a day for our guests. Thank you so much and be blessed. And I cannot forget to say, Kenya Film Classification Board, Dr. Ezekiel, you are always a driver.
Dr. Shiro.
Yes, thank you, Dr. Shem, and thank you, Madam Chair. Mine is just to say thank you all for just answering our call. And from the diaspora, especially here in California, we are saying Black Lives Matters with our Kamala Harris running for, being the running mate for Joe Biden. So we right on. But thank you so much for everything that is happening and how you're supporting the diaspora. We are ready to come back home and corroborate and work with you all. So thank you. Over to you, Madam Chair.
Thank you. And for purposes of just the official title, Dr. Shiro is known as Dr. Shiro Gikonyo Siro, or Shiro. From Moranga. That's politically correct. Thank you very much. Asante Sana and Dr. Chodo. Moving along, I think, the fact that the CS trade, Betty Minor, was able to speak and give us our blessings, that's why we were able to interfere a little bit with the program. And now we are back on. I would like to bring her on to make her remarks.
Okay, thank you very much, Rosemary. Thank you, Shem, and the entire team once again. And thank you, CAS, Dr. Rahman. We appreciate what you have said, and you've actually made my work a lot easier. I want to thank the Kenya Diaspora Alliance and the Diaspora COVID-19 Task Force and their partners for organizing this forum. And I'm sure this will be beneficial, not only for the partners present, but also for our nation as a whole. As mentioned by Dr. Aman, Kenya recognizes its diaspora community as a critical socioeconomic constituent. At a national level, Kenya has put in place mechanisms to ensure continued partnerships and collaborations with the diaspora on all fronts. I've seen Ambassador Oyugi on the forum, and we're all aware that the Ministry of Foreign Affairs has actually published a diaspora policy. This is because we recognize that the diaspora community brings to the table a wealth of human capital coupled with in-depth knowledge of evolving trends across different sectors. This meeting, therefore, reinforces the importance of ensuring that the experiences and best practices that the diaspora community has on managing the acute global crisis such as COVID-19 are shared and harnessed. We acknowledge the impact of COVID-19 on global economies, including Kenya. Dr. Rahman has shared about the health dimensions right here at home. From the economic perspective, many people, and this is leading to a global recession. And I'm sure you've also been affected. Many people have lost their jobs. Several businesses are not operating at optimum capacity, and some are actually even shut down. So we recognize that this has led to reduced incomes and spending, and many of us and many people are really struggling to survive. In Kenya, as in many African countries, diaspora remittances constitute a significant share of our GDP. In 2019, remittances from the diaspora increased from 27.5 billion shillings in 2018 to 28.9 billion shillings in 2019. This year, though we were actually quite surprised, we had thought it would drop, but we've actually seen some increase in remittances between May and April this year. And we had expected that given the impact of the pandemic, but we're very glad that this trend is still maintained of increased remittances from the diaspora. According to the Africa Union Commission, the defiant growth of remittances despite the pandemic is consistent with previously observed growth of flows of remittances of capital from the African diaspora. In many instances, actually last year, in 2019, these funds, diaspora remittances were actually higher, was nearly equal, to official development assistance. So you could clap for yourselves and consider yourselves the donors of your motherland, but since we own, we claim you, then we don't call it, development assistance, but it's a significant part of the revenue flows into our country. Kenya recognizes that your remittances will be particularly important over the coming years in creating adaptive businesses that are fit for the fourth industrial revolution. The contribution of the diaspora remittances to our national and regional economies is vital, and they will play a critical role in Kenya in the post-COVID-19 economic recovery. And some of the areas that you could consider, investing in are actually the areas that have been outlined by Dr. Rahman. We have put in place as government various measures to control the spread of COVID-19. We recognize it as a health challenge, but we also recognize it as a challenge that, it's a health challenge, but the measures that have been taken to deal with it have also had some impact on the economy and on livelihoods. We have seen a slowdown in economic activities globally and even right here within our country. But we've also seen some opportunities. And those opportunities, especially in e-commerce or digital trade, has emerged, and I think those are actually the sectors that have been thriving. In April, it was one of the sectors that was actually, employing more people because of the need to meet the demands of a lot of clients as a result of the disrupted supply chains. And therefore, we believe that this COVID challenge will give us some enhanced economic activity in certain areas. We have spoken about the capacity to meet domestic demand, especially for medical commodities. That has actually been another emerging sector during this pandemic period. So as we go forward, I think what I'd like to be able to say is that this, as we learn to live with COVID, because we don't know how long it's going to be with us, we're actually learning to adjust and to identify the different investment opportunities, both within Kenya and outside, that can help us create wealth and employment for our youth. We've finalized the export development strategy 3 years ago at the Ministry of Industrialization, Trade and Enterprise Development. We have identified various sectors where we could actually grow our export potential because we realize that the balance of trade is not in our favor currently. And this export readiness, the implementation of this export development strategy and all the attendant, export penetration strategies will actually be very helpful in reversing this trend. One of the things that we have done to ensure we can access external markets is that Kenya engages constantly in expanding its trade space through trade agreements that it has reached with many different countries. We have partnerships within East African Community, within COMESA, now with the Africa Continental Free Trade Area. And as you might have heard, we're actually starting also negotiations negotiations of an FTA with the US, and together with our partners in East African Community, also with the UK. The reason why we engage in these market access agreements is to ensure that we have a way and we have a manner of, expanding our exports. So therefore, the opportunities that exist that are currently provided, not just within, previously within the economy, in typical areas of agriculture, of manufacturing, and other services. These are opportunities that can be realized not just to supply and meet demands and work within Kenya, but also to be able to access external markets. The Africa Continental Free Trade Area will go live on 1st January 2021. We believe, and we've seen and we've done the analysis that shows us that it actually has potential to expand the market for Kenyan goods and products in the continent. Our assessment with regard to the US FTA is that if we were even to increase our market share among the goods that we currently sell into the US, we could realize, export revenues of up to $2 trillion in the period, in the next 5 years, up from the near just about $600 million we currently have. So in our view, this is actually a great opportunity for Kenya. So as a government, we are keen to attract diaspora investments, both for production here and to be able to also realize and exploit the open markets that the open export markets that we have identified. In addition, we also encourage diaspora investment to also to invest within Kenya, and to be able to do this, Kenya has put in place an elaborate Buy Kenya, Build Kenya program, which Dr. Aman has spoken to with regard to, say, medical commodities. We recently issued, a master roll of goods that will be exclusively sourced from within the country, because we believe we have the capacity to satisfy the entire public sector demand for these goods. So as you begin to think about areas in which you can put your investment, we encourage you to invest in some of these ready areas within the country, but also invest for the purpose of our export market. Ladies and gentlemen, this COVID pandemic has really constrained mobility and traveling across countries, which have, obviously negatively impacted some of the gains we have made in greater openness and flexibility in migrations. Trade is really one of the vital, or rather migration is vital for trade. So we are now very conscious as we negotiate additional trade agreements. We have paying specific attention to trade in services and the movement of persons. So it will be it's one of the areas that will be, we would like to benefit from some of your input as we negotiate these critical components. We have a trade in services component with the US. We shall have one with the UK, but we'll start that in the coming year. But I'm certain that the experience, you have your own mobility, maybe your own challenges, would be very instructive in the trade negotiations that we reach, because we recognize that services is the new frontier. Kenya and many other countries used to be very closed when it came to conversations on trade in services, but we have seen the role of services in our own GDP, so we don't really have a choice but to embrace more liberalization with regard to trade in services and the movement of persons. So we would value your input in this regard. Conscious of the time, and before Rosemary comes on, I just want to once again thank you very much for putting this forum together. Thank you for reaching out to us to interact with you, and we look forward to a continued, mutually beneficial arrangements and collaboration between those of us who are working here at home and those of you who are working in the diaspora. Thank you very much.
Thank you so much, Waziri, and thank you for just being cognizant of the time. Sikutaka kuinua hata mkono ama to disrupt. Being the chief guest, like I said, umetupatia blessings. That's why we could switch around with the program. But on this moving forward, please, I'm handing it over to Dibal, who will introduce the PS for cooperatives. Dibal, over to you.
Thank you very much, Rosemary. So we want to drill deeper with the conversation. I know there's a lot that we want to cover, and thank you, Madam CS, for those warm remarks that you've given us today. Well, we've picked some of the salient points that will be also very pivotal for our discussion this afternoon, and I know it's in the morning also, we're in New York. So we want just to start off with our first panelist, and I also am aware that the Director Diaspora Affairs, His Excellency Ambassador Michael Oyugi, also, he's really pinched for time. So I will actually try and slot him in this particular first panel discussion that we're going to have as a discussant. And I want to now also just to highlight that we have PS Cooperatives. This is Mr. Alinu Ismail, also a PS Public Service. Mary, this is Mrs. Mary Kimonye, and the CEO of KFCB, Dr. Ezekiel Mutua. And I want also to acknowledge industrial scholar and philanthropist. This is Dr. Manu Shandaria as well, to actually be in this particular panel as well. So I will begin with Mr. Alinu Ismail of Cooperatives. I'm given to understand that there is, and the government is considering introducing diaspora investment cooperatives instead of SACCOs. Kindly just bring us to speed and tell us where are we at with that particular idea. Mr. Ali, if you can hear me.
Yes, Stephen, I can hear you.
Yes.
Now, of course, first of all, let me take this opportunity to thank Kenya Diaspora Alliance for bringing us together in order to discuss the role of diaspora, Kenyans and diaspora in our economic recovery strategy post-COVID. As the State Department for Cooperatives, first of all, we want to acknowledge the role that has been played by Kenyans in diaspora in the economic development of this country, as the CS has already said, particularly through remittances that have grown to be one of the largest foreign exchange earners in this country. As the CS has said, diaspora remittances stood at more than 280 billion by 2019, and I think it's still growing. Now, as a sector, we have created a platform where Kenyans in diaspora can manage their investments comfortably through registered diaspora cooperatives, where they fully participate as well in deciding the types of investment, and also where they're directly involved in the governance of the cooperatives through the State Department for Cooperatives. The investment cooperatives are actually the ideal vehicles for Kenyans in diaspora to invest in at home. And the distinction that I want to make between investment cooperatives vis-a-vis investment or diaspora SACCOs is that SACCOs actually are built on the principle of you earning a salary. There is a check-off system from your salary. You actually save, because that is exactly what they are, savings and credit cooperatives. And then when you save, you borrow. And when you borrow, then you repay. But the diaspora cooperatives, investment cooperatives, actually means that Kenyans in diaspora can pool resources together. They have the money, and then they want to use or look for investment vehicles, which then they can put their monies in for purpose of investment at home in areas like probably housing, land, and other investment opportunities. Now, if I can just talk, there are now about 20 diaspora cooperatives that are registered, the bulk of which are in the US, and of course in Canada, in Germany, in France, in the Gulf region, and even in Nigeria and many other parts of the world. And it's still growing. I think even recently we registered 2 more diaspora cooperatives. Now, if we talk about the cooperative sector briefly for the benefit of everybody, Kenyan cooperative sector is regarded #1 in Africa, 7th globally. So it really, in terms of cooperatives as a country, we have done very well. And in terms of savings, the sector has already mobilized 776 billion Kenya shillings in terms of savings. And the asset base is considered to be around approximately $1 trillion. And it has granted loans to the tune of Kenya shillings 742 billion. So, and the sector is still growing. And we encourage, therefore, Kenyans who are in diaspora, who are willing to invest, to actually use investment cooperatives. We have told them that SACCOs may not be the ideal vehicle. Investment cooperatives are actually what is more appropriate, because then they are looking for investment opportunities with the savings or the monies that they actually holding or they have saved in wherever they are in diaspora. Now, first of all, let me also briefly comment on the some of the effects, like have been said by the CS and Dr. Amana. COVID has affected every other sector. It has also affected the cooperative sector, and immediately the COVID problem became a problem in the country. We decided as a movement to see how we can respond and supplement the efforts of actually the government. Number one, you remember that in the corporate sector, we have AGMs at the end of every year during which dividends are declared. And then we look at also how the corporates or the SACCOs have been performing. So we told the members that they can now do virtual meetings. And actually, we allowed the payment of dividends, because of the COVID, to be done virtually. Then we're having allowed societies to pay dividends and interest, through these virtual meetings. We also created an opportunity for them to be able to have their budgets approved, in order that they may be able to spend their budgets, because now gathering was not possible because of COVID.
Yeah, thank you.
Yeah, in addition, we established a cooperative coronavirus response committee where we raised some money, we mobilized some money within the cooperative movement. And as a result, we have been able to actually reach a number of members who have been impacted by the COVID. As you know, the travel sector was seriously impacted. You know that the tourism sector was seriously impacted. You also know that the horticulture sector, the flower farms particularly, were affected because now we were no longer exporting flowers. So we have been able to use this money that we collected to reach not less than roughly about 15,000 members of cooperative societies who are actually affected, particularly those who are in the businesses within the informal sector, who are in corporate, whose business had to actually close. Now, if I can just comment very briefly on some of the effects, we have seen a slight increase in loan defaults due to loss of income for cooperative members. In certain instances, we have seen loss of jobs among cooperative members, while in other areas, we have seen that members of cooperative societies have actually had to go on half salary, especially, as I said, on the hospitality industry, the private education sector, and the transport sector. And most cooperatives are actually battling or are actually experiencing liquidity challenges due to reduced problems of cash flow. We have seen instances of members, a few members even withdrawing their deposits in order to be able to use them as incomes, or members seeking moratorium on the repayment on loans, particularly in the sectors that have actually been affected.
Thank you, Bonnet. Yes, I'm sorry, let me just interpose there a bit because also of interest of time. We'll circle back to you with much more questions in that regard as well. But of course, we know, and this is a very unfortunate event that yes, many people are losing their jobs, moratoriums on loans as well. This is a reality that we are living in. I just want to rope in Mrs. Kimonye here just to tell us more on what also the ministry is doing to prepare, the public servants for the future of work. I know that right now, especially the CS, this is Margaret Kobia. He's the chair of the post-COVID-19 committee that will also chatter forward and give us a map on how we can actually go on as a country post-COVID-19, whichever year that will happen, because now people they're having bugbears and fears that this will be with us for the longest time and a long protracted time. Over to you, Margaret. Just tell us what is up your collective sleeves as far as the ministry is concerned. Future of work for the public servants, very briefly.
And sorry to interrupt, before PS Mary Kimonye comes on, I just wanted to tell our audience who are both listening and writing in questions that that presentation from PS Cooperatives was not exhaustive. But the good thing is that he actually sent the presentation. So we are actually going to, if you're interested in listening to the whole presentation, because of time limits, we can actually share it with you. It will be on the portal, which you will see when you look at some of the charts. It's going to be shared, the address. Over to you, Mary Kimonye. Sorry for that interruption.
Mary, please remember to unmute your mic.
Hello, can you hear me?
Yes.
Yeah, you now. Very good.
Yeah, I had muted because I forgot everybody else was speaking. So Dibal, I am here representing the Cabinet Secretary.
Yes.
State Department for Public Service. And she got a letter and a brief and was asked to speak on the topic of leveraging diasporic human resource for economic deepening.
Yes.
So she had given me a paper on that to read on her behalf. But cognizance of the time and cognizance of the questions that you've put forward,
yes,
I guess I will not have to read the Cabinet Secretary's paper.
Yeah,
probably
because
we have now time and protocol issues. But I was coming here to read her paper. But allow me to do this: summarize her paper, her thoughts on what she thought. Just in 1 minute, that recognizing that the diaspora has unique knowledge, skills, and competencies gathered from across the globe because of the countries they live in and work in. Countries may be way far developed than Kenya. So we recognize they could have tapped into special knowledge in these areas. And therefore, the Cabinet Secretary had prioritized areas where she thought the diaspora can look in to deepen economic development for the country.
Yes.
And some of them have been spoken to. The Big Four agenda, investing in the Big Four agenda. And the second one, it was diaspora as channels of marketing Kenya abroad, that they can be used very well because of their placement to promote both the goods and services of Kenya. I will not go into the deep discussions. And then diaspora as a resource in areas of research and capacity building, that it is possible for diaspora to be used as a channel for knowledge and skills transfer, with a mechanism well established through our learning institutions so that the knowledge that they've gained can be used. And then, of course, diaspora for institutional development. We have a diaspora investment strategy, which they can loop into, and they can be used for that purpose. So that is a very high-level summary of the Cabinet Secretary's paper. I think we'll have to send this paper. But now coming to the human resources in government. Dibal, you know, we have over 800,000 public servants working across the country. And the emergency of COVID has brought us certain challenges. One, all the protocols issued by government on social distancing has meant that we rethink the way we organize our offices. We no longer we cannot anymore hold big meetings. So we have had to go technology. So the area of technology and knowledge transfer in that area sticks out as an area we can work together with the diaspora to make our meetings and to make our engagements with our human resource as efficient as possible. Number two, social distancing has also meant that we work from home and we work from remote stations. Now, working from home brings the challenges of human resource management in terms of supervision, in terms of target setting, in terms of just tracking your workers. Where are they? What are they doing? It also is faced by the challenge of connectivity. It's not every area of Kenya you are able to connect. Number two, most of our workers live in neighborhoods where internet could be a problem. So we have this challenge. If people are living in these neighborhoods, how do you get them to work on their targets when even electricity is not in all the areas, and where it is, we have blackouts and so on and so on. So we are facing those challenges managing our workers. The third challenge we are facing is of mental health. Our workers have been used to living together in offices, seeing their colleagues. So we are seeing increased cases of depression and mental health among our workers. We are cognizant of the knowledge that the diaspora has in that area. And I know many of them are very well trained in the area of counseling and psychology. And therefore, this is knowledge that we would like to tap into. Another challenge, Dibal, is when our workers have contracted COVID and they have healed and they have to come to work. Just dealing with that stigmatization from their colleagues. So we have human resource problems, which I think with the special knowledge that the diaspora have got, with the special competencies that they have, with the special expertise we have, if we can agree on a mechanism, I think it would be very easy to tap into that knowledge. I'm very cognizant of the number of nurses trained by the government of Kenya, who have, for example, migrated to the United Kingdom. And these are people probably we can tap into their knowledge, but we have to agree on the mechanism and to also agree on how to overcome the challenges of tapping into their knowledge. So the government has taken steps to ensure that government services continue. And most of the steps we have taken have to do with technology. For example, we have completely digitized the performance contracting program. We are no longer moving around the country. So this year, everything will be done online. We have digitized recruitment of workers in government. Now, if you need a job in government, you have to go online, Public Service Commission website, and apply for a job. We interview online, and we'll send you a letter on email and also place you. And so we are making government services easy. Number three, the Huduma Kenya platform is now digitizing services. This week, we are introducing services in Huduma by appointment. So we are going as much as digital. You can apply for your ID, birth certificate, travel documents, and have the whole process going digital. So Dibal, our issue is to sustain services and to continue services. Asante
Fantastic.
sana.
Fantastic.
Yeah.
But briefly, before I let you go, just briefly,
Yeah.
are there any plans to develop these services to Kenyan embassies and missions?
Yes, yes, we are actually working on that. How do we take these services to the diaspora, mainly in our embassies, so that we can make it easy for our people? As you know, the government has allowed dual citizens, it has allowed them to vote. They have rights now, and we will work with the embassies to ensure they can access these services. Asante.
Thank you very much. Let me just rope in also the CEO of Kenya Films Classification Board. This is Dr. Ezekiel Mutua. Just also to bring us up to speed, tell us, sir, are there any regulatory incentives for diasporas who want to invest in the creative industry to bring filmmakers to come and shoot their films in Kenya? Very briefly, sir. Good to see you.
Absolutely, Dibal and CS and fellow panelists. Thank you. It's good to see all of you. Yes, the stimulus package that was put in place by His Excellency the President, including the reduction in VAT and taxation and reliefs in that area, considered also the investment in the film sector, especially in the creative sector. Yes. So filmmakers who are importing film equipment, who are coming with filming equipment, they enjoy some percentage of the waiver for the period of the COVID-19. In respect to film licenses, we have also given consideration to films or licenses that were operational, but because of COVID, there was interruption and they could not complete the projects on time. So we don't charge them for the extensions. We extend for free. We are supporting a lot of filmmakers also. You are aware that there is 100 million Kenya shillings that was provided for by the government to support the creative sector, and a lot of young people with great ideas on making films, especially that were giving information and sensitization on in respect to COVID-19, were able to access that money. That process is still ongoing. A lot of them are still accessing that money through the Ministry of Sports and the Heritage, and through the support of the Ministry of ICT. So in respect to regulation, what we are saying is we are coming up with a framework that will ensure that we have a great package that will attract great filmmakers from abroad. And in fact, as we speak right now, a lot of international filmmakers are considering filming in Kenya. Films that I have one that was going to Scotland that is now being considered to come to Kenya. I have two that were going to South Africa. We are talking to the filmmakers, and we are talking also with the Ministry of Tourism to ensure that we collaborate so that when they come to Kenya, the service crew and access to national park, for example, for those who are doing geographics and so on, they are also enjoying 50% access to our national parks. And the Ministry of Tourism and Wildlife, through CS Balala, has also given that statement that there will be those waivers and the reliefs that they're going to enjoy. And the whole idea is to ensure that in this sector, where there is so much potential for the youth, we are able to support them, to be able to cope with the situation, because COVID-19 has really affected the creative sector. This is the sector that relies on events. It relies on, going to the theater, to cinema halls and so on. And now because of the social distancing, they were badly hit. And the talents are just lying idle. A lot of them are really suffering. You saw the other day, IMAX, was being auctioned. And yesterday, when I'm meeting with CS Musheru and the cinema operators, and we came up with protocols and guidelines that are going to help Kenya to align itself to the global markets, so that when the blockbusters are being released on the 28th of August, Kenya will be also ready. And so we presented the protocols that will ensure that we observe social distancing in the cinemas and so on. And we are aligning this to the rest of the markets globally, because this is a field that is global in nature. So really, there's so much that the government is doing. And it's so nice to see that the diaspora community has organized this event when we are celebrating the International Youth Day, because really this is the currency. The youth is the currency of the future, the currency of driving the economy. If you see what Hollywood has done for America in branding the country, pushing the perspectives and ideology, what Nollywood in Nigeria has done. By the way, it's the second highest contributor to the GDP of Nigeria, Bollywood in India, and so on and so forth. This sector has a lot of potential, and it's where we need to focus our youth on. This is where we need to create new opportunities, and we are doing that even working with the media industry. There are new opportunities like Viusasa. It has become a buzzword right now, and people are able to create their content and distribute it online. And all of this, in all these things, there's the support of the government, both in terms of creation of the content, distribution, broadcasting, and even exhibition. And we are working with the filmmakers, both locally and internationally, to tell them Kenya is the preferred filming destination. We have the best sceneries in the world. We have the eighth wonder of the world, the wild beast migration in Masai Mara. Our fauna and flora is out of this world. And I think there's a lot that we can do to create jobs, even by making films in vernacular, music, and so on. So through Studio Mashinani, Cinema Mashinani, and a collaboration with KBC, we are driving this project to take them to the counties and ensure that our youths in those places can access equipment and technical facilities to be able to produce quality content that can be able to sell. But more importantly, as a regulator, we are also promoting the idea that we need clean content. We need content that talks about our values, our culture, that preserves our moral values and teaches our kids the positive social values, to work hard, to uphold integrity, and to be people of honor. And I think these are things that COVID-19 now has brought us to our senses. I think going forward, it will be easier now to embrace the creative economy more as the currency for job creation and wealth.
Yeah. Just to piggyback to what you're saying, then looking at the moral content as well, how does your role as the moral policeman fit with the Article 10 of the Constitution? We would speak about the national values and ensure that freedom of speech and expression is still protected. Very briefly, sir, as also we want to welcome more Ambassador Michael Oyugi on board as well.
Dibal, there's no country anywhere in the world that
I was going to say moral policeman, moral policeman, but sometimes you've been...
There's no country in the world that has ever developed without setting a moral foundation. If you look at the Asian tigers, they were disadvantaged in so many ways, but they started by first putting discipline and moral values and ensuring that they have a proper moral foundation. In this country, we have done so well in building the hardware and the infrastructure, but we forgot the software of values. And the reason why we have so many challenges, despite the enormous levels of development in ICT, in education, in creativity, is because our software is rotten. And we have a rotten moral fabric that needs to be repaired. And there's no better driver and a tool for transforming our values like the creative economy. So in my view, where we sit, besides just regulating and putting the age or prescribing age suitability, saying this is general exhibition, PG, not suitable for this, we have started a campaign to engage with parents, religious leaders, sectors like the diaspora community, to tell them, let us create content that speaks about our culture and our values, that tells the African story, the African narrative, so that this continent is not just portrayed as a continent of poverty, civil strife, corruption, and so on. There is so much positive content that can be created out of here. And so that campaign and the synergy, collaboration, and networking, including our collaboration with the Kenyan Diaspora Alliance, I think will be a major boost to the new networks and the new collaboration that we require to change the mindset of our filmmakers, to know that it doesn't have to be dirty to sell. Music doesn't have to be the Wamlambe stuff. You can create clean content,
we get the point.
And make money.
Thank you, Dr. Ezekiel Mutua. Thank you very much. So I want just to also bring up Ambassador Michael Oyugi. Your Excellency, first of all, thank you for joining us. But my question will be drawn from the Kenya Diaspora policy that was launched in 2014. A lot of good things are actually indicated or actually there in that particular policy. But when it comes to the implementation of it, it has taken such a slow pace of uptake. I want to pick up two things. First of all, we have the Kenya or the National Diaspora Council of Kenya that was to be established. Also, the Diaspora Retirement Saving Schemes. This will have been worked through the Kenya, or that is the revenue, that is RBA. Bring us up to speed and tell us, where are these particular two pivotal aspects of that policy at right now? Ambassador, remember to unmute your mic, and thank you for being amazingly patient.
Yes, I'm told that we are being challenged by technology for Ambassador Oyugi to join, but there was a question that had come in for Dr. Ezekiel Mutua to very briefly touch on the digital tax and the impact to the future.
Absolutely. Like I've said, with the COVID now, what COVID has taught us is that we cannot continue with the traditional way of doing business. Even when you look at film distribution, we cannot be distributing by using DVDs in the market the way we used to do. And now with the ICT and with the digital migration and the expanded spectrum, there are more opportunities online where our young people can create their content, user-generated content, and upload it on the YouTube. And one of the things, Dibal, that we are doing is that we actually don't charge for uploading content on the YouTube. Neither do we require a license for people who are doing that kind of business. All we need is to work with them to ensure that it does not violate the moral values of the country or the culture of our country, but more importantly, to ensure that we support our youth to be able to tell their stories in a way that it is edifying. So the way to go is now connecting through technology, opening up the market instead of focusing on the 40+ million Kenyans viewers. You can now upload your content online, and then you're attracting the 7 billion of the global population, and everybody there is available to watch your content. Then that's why I was saying the concept of View Sasa, opening up YouTube channels, going thematic, because the whole idea about digital migration was to ensure that we provide multiplicity of channels for content distribution.
Thank you. Thank you, Dr. Ezekiel Mutua. Right, let me just bring on also Dr. Manu Shandaria to just give us a scope of what is happening, especially where the manufacturing sector is concerned. And sir, do the large industries through the Kenya Association of Manufacturers have a program to loop in diasporas in the business as we speak? Manu, remember to just unmute your mic, and thank you for being amazingly patient. If you're still there, you can hear me.
I can put the mic on now.
Thank you.
Thank you very much for this discussion. The point that we are looking at right now is immediate what can be done. And I think that the majority of the investments of the industries now in the country are now started operative. They're operating some at little lower speed, but I think they have started operating. And this is one good thing that has happened. Now, what is required really is to attract the diaspora from all over the world in terms of investment by making investment possibilities as quick as possible, least amount of bureaucracy, because they just don't have the time. They're not interested in wasting their time. So unless and until we are prepared to do that, I think we will not be able to succeed. And I think that we have to live with COVID. The question is that let's not get worked up and saying that COVID, if we understand what the problems are, but we have to live with it, and the leadership in the country must push that yes, whatever it comes, we'll tackle it, and we want to tackle it. Now that means the government should be on the feet, clearly making very sure that anything and everything that makes investment, anything and everything that makes business a possibility, move as fast as possible. This is, I think, the third meeting I'm attending regarding the COVID and post-COVID. All I'm trying to say is please, government must relax. There is no question of regulation. Regulation is not the answer. Today, the answer is how to move and how to get on with the job. And I'm sure that we can do it. The point is that, but it's not at the speed that we are going. The speed must be accelerated. And there should not be a place in the government within a week that you do not have an answer. Because people are not prepared to. There are so many countries available today to invest. Why should it be Kenya alone? The diaspora can go and invest in Nigeria, in South Africa, anywhere they want. The point is, because they are Kenyans, they feel this is my country, and the feeling of that, I am a Kenyan, and I got to go out of my way to make very sure how to improve and how to change the situation that is facing us. I think that can be done, but that fear must be out first. That we cannot do it. It's going to be impossible. That must be out completely.
Manu, before I let you go, also you attribute success to stationing family members internationally, aside from innovative methods of accessing capital and acquiring talent. Why do you think that stationing your family members also internationally has been very pivotal in driving the success of your firms, right? This is maybe a more nuanced way of looking at the diaspora?
No, because the size of the market, there's always a limitation of the size of the market. You can do something in a population of, say, 50 million. What you can do in a population of 100 million or 500 million, it's a very different issue. So the point is that the expansion of business can only take place. We cannot be 20 businesses. Our businesses are now covered only on 8 or 9 items. And those 8 or 9 items needs a market, because we are the leaders in some of them. And so we need the market. And there's no other alternative but to go out to find out where the markets are. And the whole issue, why Kenya is not attractive today as an investment, that we got to ask ourselves. I cannot give the answer that why we are not. We might be, all the people that we see from the government will say, yes, we are prepared to do this. But when it comes to paper on the table, has it been answered within a week's time? Are we positive? Are we supporting? Are we not regulating, but inspiring, pushing, making very sure that it happens? The medical facilities today, why can't we get it more medical items manufactured in this country? But you go to any pharmacy, the manufacturer of pharmacies, just find out the amount of problems. It's unbelievable.
Thank you.
Because nobody wants to take that on their hand.
Thank you. Thank you, Dr. Manu.
Thank you.
Right. I wonder if we have His Excellency Ambassador Michael Oyugi back so that we can continue the conversation and then wrap up this particular session. Open it now to the plenary for questions. If they have, they can fire them. Ambassador Michael Oyugi, you can hear me? If you're there? Or we still have some technical challenges? Ambassador?
Sometimes it happens. I think we'll...
I can unmute. He's there.
Yeah.
He's there. Ambassador,
you can unmute
your mic so that we can actually get to hear from you as well. I know you're strapped for time. You can hear me, Ambassador?
All right. Yes, I can hear you.
Oh, very good.
Fantastic. Now, I know earlier, I don't know if you got my question. I'd asked you whether the government is doing anything to the Kenya Diaspora policy that was launched in June 2014. And of most important is the aspect of the National Diaspora Council of Kenya that was to be established, and also diaspora retirement saving schemes that will have been actually channeled through RBA. What is the current state of play, sir?
Thank you, Dibal, and it's interesting to see you at a different
Ambassador?
forum. Yes, can you hear me?
Yes, perfect.
Yes, we can hear you. We can hear you.
Continue.
Yes. Okay. All right. I will talk I will react to that bit about the diaspora policy.
Yes.
And say that we have moved a little. It's not sufficient movement in terms of implementing the policy. We have reached out to the diaspora because the policy requires that NADICOC comprises representatives of the diaspora and the other half representatives of different stakeholders in government.
Yes.
So the challenge has been in working out the representation of the diaspora side. There has been some provisional arrangement made, but which may not be flowing well. But we are looking into it, and we hope that we'll be able to get through on the diaspora side to complete and get representation so that we can formally launch it. So for the time being, it's not functioning as envisaged in the policy because my department is still doing a lot of work that actually could be better performed by NADICOC when it gets up and running.
But sir, we're talking 6 years
group,
down the line. We're talking 6 years down the line, sir. And I think
yes.
Also in the most of the forums that we've had with Diaspora Alliance, this is a question, it has been a question that has come to the fore most in times. 6 years down the line, still a glacial slowness. Why?
Yeah. Now, well, Dibal, what I would say is that on the sidelines of this,
yes,
we are also reviewing the policy internally because since the policy was launched, a lot of water has passed under the bridge, so to speak. So there is also need to look at the policy and really update it rather than just keep it the way it is, because there are developments, there are situations that have evolved since then, and we need to take those into account. But yes, it is time because, as you point out, 6 years is quite a bit of time, and the situation should be different and better than it is now. But I would say that we are on it. We are doing our best, and I hope that we will have something to say for it in due course.
All right, thank you very much. Maybe, because I know you're really pinched for time as well, it will be maybe a handy opportunity for me to ask you.
That's one question I'd like to say. We will be doing, there is no time for we will. We want to do it, we'll do it tomorrow. That's the attitude we should have.
Yes.
Maybe let's allow Ambassador Oyugi.
All right,
first.
Continue.
No, I appreciate Dr. Chandaria's point. It is the fact that time is of essence, and I appreciate that, and I take note of it. It should not be, postponement and futuristic. I take the point in good stride, Dr. Chandaria.
Right.
Yes.
Maybe you can just bring us up to speed. If are you finished with your thoughts yet? I wanted to ask you about the integrated database, about also the people who are in diaspora. How far has the ministry also updated this? Can you maybe give us also the current state of play, briefly?
Yes. Yeah, that is up, and in fact, we are running with it. We are in constant touch with the missions because we rely on our missions to collect data from the diaspora out there. And we have done this as at the end of last year, we got updated data. And we are also moving to bring quality into that data because previously what we'd been collecting was merely the number, basically, of diaspora and where they are. But we are now going for disaggregation, whereby we would look at matters such as gender, age, skills, and so on. So we are doing that, but we have challenges on that because we can only go as far as our diaspora out there also cooperates in coming out, for instance, to register with the embassies and consulates that we have out there. But this registration has not been as fluid as we would expect. We know that there are more Kenyans in the diaspora than what we have in the files. So we are also trying to endear ourselves to the diaspora out there so that we get more from the associations, because this is probably the best way of having an actual database. But we are also working with other agencies, such as the UN and the Kenya Bureau of Statistics and the Central Bank, to see what we can get from them. So the database is ongoing work. Dibal.
Thank you, Your Excellency. I really appreciate. Right, I just want to open the floor maybe for a few more questions before we gravitate to the next panel. And Rose, you can actually assist me on this. If there are questions, maybe this will be the right time to paper them.
Yes, thank you very much. Yes, and also just a reminder for our panelists, if they have their handlers and anybody to probably tweet about this meeting, because I know people have been sending in questions and you know, they're coming in. And also a reminder of some of the guests that are still on the panel in the second segment of this program. And that is fellow CPA Wycliffe Shamia, who is the executive of the Capital Markets Authority. And we also, Paul Russo, who is the CEO of the National Bank of Kenya. And we also have our brother here in my neighborhood, Sam Mwale, who is the head of KEPSA. So we have a couple of questions that have been asked that have been flowing.
Moderator, please.
Yes.
Sorry just to note that Ambassador Oyugi is actually representing Honorable CS Foreign. But in case he had some closing remark, you know, Foreign is our parent ministry. You'd have given him 1 minute, unless he's finished, Ambassador Oyugi.
I'm still there, Dr.
Yes, no problem. Yes, we do know, yes, the invite was to the CS, and we are really very gracious that you were able to stand in for the CS Rachel Omamo. Any thoughts, any concluding remarks? MOFA is our parent even here in the diaspora. Go ahead, Ambassador Oyugi.
Yes, thank you very much. Apologies, I've had numerous technical problems in my office today. It's never happened before, but I don't know why it chose to happen today. But I will just give quick thoughts on our hope and expectations of diaspora in the post-COVID network. We continue to work with the diaspora very well, and we believe that there are a strong and potentially powerful partner in development endeavors in the country. So 4 or 5 points very quick. Number one, I will say that the diaspora has the power of networks. And through these networks, I'm sure that we, as a country, we can benefit by exploiting the power of networks of the diaspora. That is one. Number two, I would say that as the situation in this COVID era is further unraveling, of course, we have noticed that there are gaps and in areas of decision and policy, our health systems and so on. And this pandemic provides an opportunity to fix some of these gaps. And I think that the diaspora can help us in that respect, in their thinking. The third point is about technology. This COVID experience, I think, is teaching us a lot on the need to focus on technology that can help us go through some of the challenges that we are facing in this situation of diaspora. Connectivity and also harnessing technology to improve on our agriculture, food security, and so on. There's a lot that the diaspora can help us with in this respect. Number four, I want to talk about the youth in the sense that we read from reports that in Africa, nearly 20 million jobs, most of them in the category of youth will be lost because of pandemic. So we need to find ways of addressing this, because unemployed youth, we know, is a source of a potential source of instability. So how do we get around this? How do we encourage the youth to mutate themselves with the situation? Technology, again, can come in here handy. And I think that's an area where diaspora can be very useful. The second last point is about just upskilling, reskilling of the workforce and so on. We have seen Kenyans really being creative in surviving the pandemic, and it varies. We've seen pilots and air crews going to make pastries and sell this and so on. Schools turning to chicken farms or residential accommodation and so on. So I think this shows that there's some reskilling and training that we need to do. And diaspora, again, has a potential of helping us in this respect. Finally, on remittances and investment, I had a lot when my connection was still good. There was talk of remittances and how these have increased and so on. But with diaspora and its impact, I mean, with the COVID-19 and its impact on the diaspora, we expect that this area might be affected. So we want to hear from the diaspora what ideas there could be that could help maintain the flow of remittances, and also not just limiting it to the remittances that we normally have of individuals sending money to their accounts back home, but also encouraging investment in other places like the financial markets and the bonds and so on and so forth. So these are some of the thoughts that I would want to share with you as diaspora, and encourage you to continue the dialogue with us here at MOFA and see what synergies we can create to make the best out of diaspora. Thank you very much, Madam Chair.
Ambassador Yugi, as you said, I think the technology there is challenging the office. Yes. I was just going to go through the next segment, which is questions that have been asked or comments that have been made by people. There's one that said, thank you, CS Betty, great keynote address. And at the same time, also asked a question to CS Betty Minor. What are you doing to improve to make business easier or less bureaucratic? That's addressed to, I'm just taking some of the questions randomly. There's one also that talked about Manu, congratulating him on his intervention, and said, Manu, yes, mostly Kenya is not attractive because we don't want to genuinely and seriously fight and end corruption. That's a comment there. There's a question from Rachel, I think in the Netherlands. Dr. Ezekiel Mutua, thank you very much. You have hit the nail on the head. We have amazing, solid, good infrastructure all around, but let's deal with the moral values. They are decayed. Then there was one also addressing the cooperatives, for PS cooperatives. How do you disregard circles in the diaspora, and what are the reliable sector during the pandemic? What is the take of the government on the economic recovery? This is from Joshua Kengere Mogaka. I believe in the US. I am just going through the questions as they come in. How can diaspora effect narrow down the research gap between North and North, South and South infrastructural development, capacity upward momentum, research production into tangible and solid results? Back to you, Deba.
Thank you very much. Maybe we can give them a handy opportunity to respond to those questions.
Starting off with the chief guest.
Of course, also appreciate the comments from some of, yes, for the chief guest, CS Betty Minor. CS? CS, Maybe you can unmute your mic if you're still there.
The ball, I think Madam CS stepped aside briefly.
Briefly,
Her
okay.
people are there, but can we allow the 3 remaining panelists, please? Just brief. Then we open discussions, if you permit.
Yes.
All right, fantastic.
Go
So
ahead,
let's
Dibal.
just move on, because I think, Madam Chair, you had already introduced them, and we want just to gravitate to that particular session as it is right now. Thank you for being amazingly patient. CEO Paul Russo of the National Bank of Kenya, and also Mr. Wycliffe Shamia, who is the acting CEO of the Capital Markets Authority, and Sam Mwale, who is a Kenya, that is a private sector Alliance Diaspora representative. Thank you so much for being amazingly patient and just following the conversation as well. I want to begin with Wycliffe, and just to ask you, of course, looking at the security markets as it is right now, is it true until recently that 70% of assets at NSE were foreign owned? And now that we have COVID-19, we've witnessed also the flight of up to 30% of those assets. Are there any deliberate efforts to attract Kenyans in diaspora into the security markets as well?
Thank you. Thank you, Dipal. I don't know whether you can hear me. You can?
Clearly. You are coming through clearly.
Now, thank you for that question, and I am happy to be part of this very distinguished panel. It is true, when the first case was announced in March, actually up to that point, most of the shareholdings in the listed companies was in the hands of foreigners. And as you'll imagine, of course, when the first case was announced, there was actually a flight, of course, because of fear of loss of investment. I remember the first day, I think we had to put the exchange on hold just to control the fear that was running around. But I can tell you, and for sure, that within few weeks, we saw quite a lot of activity, and we thank Kenyans because the local investors came in to fill up the cup. And I can tell you, if you compare their turnover figures for, say, February and March, you find March was even much higher. If we talk about it in terms of US dollars, you'll find in March, in terms of equities, we did a 183 million. And in February, we had done 119 million. And as we speak, by the end of July, it was around 130 million US dollars. So to us, in fact, we are amazed because it looks like either the locals retained the position of buying from foreigners, but what we have seen is foreigners came back, because I think the fear had been we will be hit very badly, but that didn't happen. And we have seen them come back again to the market. So actually, just to stress the issue of being very transparent and leaving things to flow on their own without a lot of interventions, as Manu has indicated, we feel foreigners have assessed our situation and they are back in the market. And amazingly, the market is as high. Now, maybe the question is, how did we have the market activities run that way even during this pandemic period? I'll talk about digital platforms that are being used for online transactions, which have just proved, like, for example, maybe we may not require the manual systems that we have used in the past. So just to say, it is investors assessing the benefit they get from the market, and of course, against the fear that was in terms of loss of investments.
Right, thank you. And maybe you can also bring us up to speed on how CMA, you're planning to sensitize and mobilize diasporas to get more involved and invest in the money markets and securities, and also just touch up a little bit on the green bond. I know that was a new baby, a new kid in the block as well. How has the green bond also really, has it taken up so much interest, especially in the diaspora? briefly.
Okay, thank you. And maybe just to stress the point that as CMA, we have always remained in touch with Diaspora. You will maybe remember on 18th of June, we had a very huge and successful event on CMA Facebook, where we had up to around 19 attendants from Diaspora. And we keep on doing this every time. It is very important for us. And we think this is the time we really require Diaspora. And I like the discussions around what do we do to bring back the economy, especially the real economy. And we are saying, perhaps as Kenyans, we need to be bold enough to be available to finance our own operations. I liked what Dr. Manu Chandaria pointed on. As we work to relax regulations, I think we need to see Kenyans on both sides, demand and supply, so that the institutions, the entities that we expect to see there producing the real economy have access to funding. And perhaps as you talked about, Econ did the first green bond. Yes. And I'll tell you, what we have seen is most people bought the little chunks that were on issue to hold to maturity because of the returns. And we are hoping that as we expand the issuances, especially around green bonds, then we will see more people getting very much involved.
Right, thank you very much. I just want to rope in now the CEO of National Bank. This is Paul Russo. I know also the banking industry, there has been a lot of challenges as well when it comes to COVID-19. And when it comes to remittances, how have you been able to configure, maybe as a banking sector or as a bank yourself, to the current situation at play? Paul, remember to unmute your mic.
Thank you. Just I'll try and be brief, and thank you so much. I think one of the things that we've seen banks do, and the central bank has led on this, is in terms of enabling customers to transition in this particular environment. But when you come into specific, to go into remittances, our view is in the immediate term is a lot more about partnerships, because it is one thing to receive the remittances, but it's the next thing to say, what actually does that do? And my personal conviction is we need to follow that value chain and support either the remitter or the receiver to achieve a certain meaningful objective. So if I was to refer specifically to our bank, we've been engaging in quite a number of webinars and forums with the Diaspora team, and we are a strong partner of KDA to ensure that at the end of the day, that money that comes through does something meaningful for the person that remits or the receiver. I think the major bit is about meaningful investment around it. How we need to move to a different level of KYC, in my view, because the traditional KYC makes a little bit, a lot complicated. So how do we work with regulators to simplify KYC? But also, I think I'm a strong advocate of how do we reduce costs in that whole process of remittances to then encourage that a particular bit. So we've built a network of relationship managers. We've built a network of engagement with all Kenyans in the diaspora, with embassies. And my push is, and I second Dr. Manu's point of view, we have to be bold. We have to think a lot different, and we have to raise our risk appetite in how we try and engage, obviously in a very cautious model. Thank you.
Thank you. Fair enough. But before I let you go as well, just tell me briefly, how does the acquisition of a bank by KCB affect, diaspora customers and the shareholders? Just briefly.
And at the same time, a question has come in from the listeners who are also asking that acquisition, can you allay their fears and their concerns that their money is safe, Bwana Russo?
Thank you. I can assure you the money is safe. So NBK is now a subsidiary of KCB Group PLC. KCB Group PLC owns 7 or so companies directly. So it owns KCB Bank Kenya 100%. It owns National Bank 100%. And obviously it owns subsidiaries in the East African region, whether it's Kenya, Uganda, Tanzania. From the onset, the group realized that NBK has a complete different competency with KCB Bank Kenya. And the board resolved to run NBK as a subsidiary on its own. One of the things that we must say about NBK, and I'm a group executive, so I can speak about this, is that is not only part of the history as KCB has been, but it's been offering solid service to Kenyans in across the world. Definitely, it had governance issues. It's fully run with a new board and a new management, which I'm part of. It subscribes to the same standards of KCB Group PLC. It runs that journey. Ours is to not compete, but to create a whole complete different model of partnerships. So hope I've answered you on that particular.
Right, thank you. Maybe just a bit, Tom Amond is asking, the cost of remittances is very high. International civil society is vigorously discussing these issues at the moment. What plans has maybe the banking sector to try and lobby also internationally for reduction in the cost of remittances? Just in the bit of remittances, I know he's also addressing the question to the government, and you're not in government, but you can actually speak to just briefly.
I think it's true, and I've mentioned that up front. We really have to bring that cost. And for me, it is about what partnerships we build across the different continents or markets in which our diaspora Kenyans live in, and provide a straight-through processing in terms of how that goes through. I think if we find enablement and value to deliver for a person, I think banks or any other party that has played in that role, and maybe many people might want to kill me for this, focused on getting that value just because of the price. I think we need to say, what value are we adding across the chain to then make it meaningful for everyone? And I'm of that view, of a strong view, that we have to bring the cost down from a remittance perspective and cost of remittance, but make the investment meaningful so that it then adds value for us, even as bankers end to end. There's absolutely no need of receiving money and you are paying it out straight away for a person just to consume. And we have to identify who is the eventual receiver and how can we help that person, whether it's in literacy or also in building trust. Because one of the biggest issues that I've realized is trust. So how can a person sitting in the US remit money, maybe for a house to be built, and be sure that it'll be built to the quality at the right cost, right return, and therefore it gets the value out of it? That is the role we have to play as banks. And that way, we will get a better way of reducing the cost. Thank you.
Thank you very much. Right, let me try and rope in Sam Amwale now. So thank you for being amazingly patient since we started. And we can speak about, wider policy issues, because I know you're very conversant with this when it comes to also Africa. Earlier on, we had CS mentioning the Africa Continental Free Trade Area, which is due to be implemented on July the 1st. And now it has been pushed to January 2021 because of the pandemic. When the bloc becomes operational, it will be, we know, the largest free trading area in the world, covering some 1.3 billion people in a $3.4 trillion economic bloc. We're wondering, from your own assessment, are we prepared right now, given that now when you look at most countries, they have this economic nationalism. We're never, because of the COVID-19 reality that we are grappling with right now. What is your assessment with this particular bloc? briefly.
Thank you, moderator. Thank you, chair, and thank you all the distinguished guests, all protocols observed. I think the first thing I would say is that the 10 years that are ahead of us, what I'd call the post-COVID decade,
yes,
will be very different from what we had before. And the fact that we are having this kind of meeting on Zoom and connecting everybody from Australia to China to the US shows you that this is a totally different world. If I may address your question first before I make a couple of points that I prepared for, the fact is that because of the shock that COVID has created, many countries, including the US where I am and even Europe, are rethinking their supply chains.
Mm-hmm.
And that then means that there's an opportunity for countries that are agile and nimble to reposition themselves. And Kenya can be one of those countries that could reposition itself, take advantage of that possibility of relocation. And the fact that the Africa Continental Free Trade Agreement then will come into effect in January would mean that being located in Kenya is an incentive for somebody that is investing from outside, because you have an Africa market. You're going beyond 50 million people to 1 billion people. And so we need to be actively positioning ourselves and marketing ourselves quietly in that light, that if you're thinking of repositioning your supply chains, your global supply chains, think Kenya as your platform into Africa and into the rest of the world. My second point, and I'm very pleased by what I've listened to very carefully, is now I can see a recognition, I myself, having been a PS before and coming here, of the fact that the diaspora are Kenya's most reliable economic and social catalyst from abroad. Not only are we going to be the most reliable source of remittance, but going forward, we may become the most reliable source of foreign direct investment and the most effective agent of providing Kenya's entry into markets where we live. Nobody knows these countries as we do. And I feel that a lot of the companies don't make use of the diaspora as their sales agents in the countries where they live. How would you know Australia if you don't live there? Or South Africa, or China, or Germany? There are many, many Kenyans all over the world who live in these countries and have the potential to be sales agents or marketing agents for many companies that are operating from Kenya. And for me as the KEPSA rep here, that's what I want to encourage, that if you're going to expand in the UK market, look for Kenyans that live there. If you're going to expand to Australia, look for Kenyans that live there. Then the third thing, because we don't have much time, is that we need to review our laws. For example, the Companies Act and many of the acts that regulate the economy, to recognize Kenyan-owned diaspora companies as if they were Kenyan businesses. That way, that will achieve your greatest transfer of knowledge, skills, and technology into the company, because then Kenyan diasporans can bid on any tenders like any other Kenyan company. And they're going to come in with their skills and knowledge and capital and help transform the country. So if you have a company, for instance, that is 25 or 51% owned by Kenyans in Australia or South Africa, why can't they bid to do the work as if they were a Kenyan company and be certified as a Kenyan company, whether it's engineering work, whether it's consulting or whatever it is? Many countries like India have done that. They even have a cabinet minister for that in India. I mean, Ambassador Yugi's position is a cabinet position in India. That's how seriously they take the diaspora. That's how you transfer technology, that's how you transfer capital, and that's how you fertilize what is happening at home. And finally, now that we have proved that AGMs and board meetings and all kinds of decisions can be done on digital platforms, There's no reason why Kenyans in the diaspora cannot be board members of both private companies and state companies, because they can attend the meetings virtually. They can sign off on what needs to be signed off. So again, when they come in as board members, they also bring in their knowledge, skills, and networks. What I'm saying is that we need to leverage people that are living in 12 to 15 time zones and say, these people are our greatest external resource. They are a catalyst. They're not additional. In chemistry, the reaction doesn't take place until the catalyst is put in. Kenya's socioeconomic transformation going forward needs that catalyst, which is this diaspora. And lastly, Dr. Rashid Aman, the CS for Health, gave some excellent ideas. And I kept thinking, if we had the CS for Agriculture and so on and so forth, we have so many research institutions that could gain, and universities that could gain enormously from the knowledge and skills of Kenyans abroad, if we could have some form of visiting fellowships, which could even be supported by the ministry, so that every summer, when all these scholars and intellectuals are relatively free, they come and work at home and transfer some of those skills. And you then have a situation whereby the country is continually fertilized by new ideas. So for me, as the KEPSA rep, I see that every Kenyan abroad is a potential business agent, not only in the countries where they're located, but also for the development of Kenya. And that's what I would like to propose to this. And I want to echo Dr. Manu Chandaria. It's not the future, just get these things done. It doesn't take much to change the laws and regulations to fully incorporate Kenyans in the diaspora. Thank you.
All right, thank you. Maybe just briefly, 1 minute. Yeah, Mr. Mwale.
Yes.
Just back to the tariff. Don't you think coordinating the tariff regimes across the continent and the transition to a single market should be launched under stronger economic conditions? And looking at where we are right now in January, do you think much will have changed and things will have been diametrically different then, briefly?
My view is that, I guess I'm a bit older now. You take the world as it is, okay? Mm-hmm. And you start by, first of all, making sure that the kind of arrangements that are in place now actually can deliver some of the outcomes that you're looking for.
Yes.
You may realize that the biggest block in Africa continental free trade area is actually COMESA.
Yes.
And I think most of the analysis shows that it's the former COMESA or the current COMESA countries that are going to benefit the most from this free trade area, okay? So if we can work carefully to show that it even works in the former COMESA areas, even as we then move west towards ECOWAS, former ECOWAS and other communities, then people can begin to see what works. And what I feel is that in policy work, people are very cautious and they tend to go with experience. So I would say, Jabal, that in January, we go full-hearted and let us learn as we go along. Mm-hmm. Because if you ask too much in terms of change at the beginning, then you will delay everything. So better to start where we are and then grow as we go along.
Yeah. Right, thank you very much. So in the interest of time, I just want to take 1 or 2 questions before now we hand over the meeting to Dr. Shem Ochoa to give closing remarks. I think this will be a handy opportunity to just take a few questions because also we're really strapped for time. So kindly also observe brevity, which will be of essence because of time as well. If there are questions, Rose, maybe you can pose 1 or 2.
Yes.
I think let's just take 2 questions.
Yes, all the speakers have been commended for doing a good job. particularly Mzee Manu Chandaria, who just intervened and said, just do it. It sounds like a logo from Nike, but really, it's high time. Let's stop complaining. This is the new normal. Let's just do it. This is one of the comments that came up here. Some of them are addressed to either the government, somebody, Ruben Degwa, asking what avenues is the government using to disperse the COVID relief funds to the MSMEs, the small business people. Ruben Degwa is asking, he's in Australia Alumni Association. I think the question from Tom Amonde was tackled, but otherwise people have just been, commenting, asking for even more time. But I'll tell you about this. This was a teaser. This was just the start of the series of webinars that KDA will be organizing. And so far, we actually have in store for you other guests who are coming. Everybody is excited and they want to share with the diaspora and engage with the diaspora. In fact, we did not exhaustively today go into the details on coming up with solutions, our concerns, but actually it was just statements like what on behalf of CS Mutahi Kagwe talked about, the CAS, Dr. Rashid Aman. I mean, it was quite loaded. It had a lot of information there that needs to be unpacked, and a lot of questions have been coming on that, just saying kudos to him. So these are things that we may follow up later on as we plan our webinar. And I don't want to take too much time because there are a number of questions that have come in, and I don't want to leave out anybody, but I think we want to engage this audience that participated today. Come back, check out the KDA portal. There'll be information there. It will be on Twitter, and I know some of you have been tweeting about this on some of the series of the webinars that we'll be organizing. Back to you, Dibal.
Right, thank you very much. And because of interest of time, I think I'll just hand it over to our global chair. This is Dr. Shem Ochuodo, now to just give some closing remarks. We're strapped for time. Over to you, sir.
Thank you so much, Debal, our chief guest, Honorable Madam CS. You've never been a greater inspiration. Our keynote speakers from Honorable Mutai Kagwe. Ambassador designate to Korea did call earlier on. We can't thank you enough. There are many things we're going to do together. There are many eminent members we didn't mention. Ambassador Cleopa even typed in. And Ambassador Enda is following from Doha, Qatar. Ambassador Machage from Abuja, Nigeria, and all the other eminent people. Even Dr. Tom Amonde all the way from Trinidad. All the 5-6 continents are represented. We can't thank you enough. Our corporate National Bank of Kenya, without you, this wouldn't have happened. But our technical team, I can't forget you. And as Madam Chair of the Diaspora COVID Task Force, Rosemary Musumba, UNICEF New York, has said, we have a raft of webinars coming up. This was just Kionjo in Kiswahili. So end of this month, we have the word of Bwana Governor Central Bank. We'll be hosting him. So stay tuned for that. Mid next month, we are hosting Africa CDC together with ICAO and our Ministry of Transport. End of next month, Madam CS, Professor Gender and Public Service has indicated subject to no other critical engagement coming on board, will deep dive further. So Honorable PSS cooperatives, we can't thank you enough, Dr. Ezekiel and everybody, and of course our moderators, Debal, you become much younger, man. We can't thank you enough. And the Fundi wa Mtambo, led by diplomat Steve Machage, Dr. Martin Koyabe, Commonwealth Telecom Organization, London, Paula Peda in Yemen, and the entire team, James Kambaki, South Africa. We can't mention you all, but we have typed some of the names on the chat. This information will be available on our portal. Keep visiting, keep tweeting, be blessed. We look forward to an awful Kenya. And I can tell you lastly, since KDA represents East Africa region at the Africa AU ECOSOC, Economic, Social, Cultural Council. We are set to drive this agenda, not just for Kenya. And East Africa region includes 14 countries, down from Madagascar up to Ethiopia. So stay tuned and be blessed. Thank you so much, and be blessed. Over to you, Debal and Rosemary.
Right.
Yes, in conclusion, I know you mentioned a couple of people, but let me just read out a list of people, because other than the team that was helping our chief guests and their people in their offices, we also have Steve Machage was mentioned as the technical coordinator, and then Dada Mudhoni Gichohi, who is our KM or Knowledge Management Coordinator and Guest Relations, Miss Samali Kirika, who has been doing branding on behalf of Black Citrus, and she's the CEO. Dr. Martin Koyabe has been mentioned. She is the CTO in London, who was in charge of quality control. James Kambaki is in South Africa handling resource mobilization, but otherwise he works with MSF. We have Paul Apeda, who works in Yemen, but is supporting us. So you can imagine we have people from all over the world. Miss Susan Mwangi, who is the communications and guest relations. Peter Mutua, who is the deputy technical coordinator. Austin Oduor, who is the portal advisor. And of course, lastly but not least, Miss Knight Nyaribo, who's been handling the help desk, KDA Secretariat, and the COVID task force. So, I mean, we may be the face, but there was a lot that was going on behind, people taking questions, just allaying fears where there were technical glitches here and there. And of course, our parent, I would say Ministry of Foreign Affairs, Ambassador, Yugi, braved, even with the glitches and the, technology failing him, but he still came and was able to deliver, a very, what I would call a very promissory, note, very upbeat. We often complain. One of the things that I've said living in the US is that we always complain about home and this and that. But until we're putting together a show like this, that's when we realize that we are all interconnected in one way or the other. So other than just complaining, and this is the new normal, what can we do for our country? Yes, we have that space to complain, to say anything, but at the same time, what are we doing at individual level? So Manu Chandari, I really gave us a challenge. Manu, I remember you from all those days, and you're still going strong, guiding us, holding our hand, and just supporting us. We love you. And, I just want to thank all the panelists and say from the bottom of my heart, this has been a great evening, a great morning for us in New York, but just a great happening where we as Kenyans, we can discuss, we can agree to disagree, challenging each other, whether this policy is working. Where else can you have this space? Some of us have worked in emergency countries, have worked in Afghanistan, in Iraq, going to church in some of those places. It's just, you cannot do it. So let's look at the little blessings that we have in Kenya. Yes, complain, but at the same time, take the government to task, take all these individuals that were here. And I like my brother, Paul Russo, who really was very candid in his presentation and as our partner. And my neighbor here, former PS Sam Wale. So I want to really thank you. I want to bless you. And this is just the beginning of a long partnership. And please, when you get our invite, please do acknowledge, because we want to continue engagement and feeding Kenyans on what is being done, what is not being done, and how we can do it better. Back to you, Dibal, to conclude.
Right, thank you. I know we have spilled over, of course, from our intended time to actually stop this particular webinar, but I want to say thank you so very much for being amazingly patient and sitting through the entire webinar. Thank you for our audience who have also, shared your questions and your contributions as well, and even your comments, your positive and negative as well, just critiquing and telling us how we can do it better and where we've done even better. Thank you so much. We really do appreciate that. I don't know. First of all, we had the voice of Shiro, Dr. Shiro, if she's there, who is a co-chair. We'll give you a handy just a minute to say something, and then we'll actually adjourn this particular webinar. Dr. Shiro, over to you if you're still there.
Yes, thank you, Dibar. Mine is just to say thank you, and God bless. Thank you.
Brevity, right? Thank you so much. So on behalf of Kenya Diaspora Alliance and our partners and the government officials, we want to say thank you warmly for the entire session we've had this. Of course, as we promised by Dr. Shem Ochodo, we'll be having more and more of these webinars. So we're looking forward to actually have that particular discussion also with the governor of the central bank as well. Thank you so much. And thank you for your valued company. Enjoy your evening and morning in New York. So you can live at your own pleasure.
Thank you.
Stay safe. Thank you.
Bye-bye.
Bye-bye.
Bye.
Bye.